To Health Check 10 now, more than 18,000 people in the United States will be diagnosed with esophageal cancer this year, and the American Cancer Society estimates more than 15,000 will die.
That's because it's often an advanced diagnosis. A local organization says raising awareness is the key to catching it early. Here's Barbara Morse Silva.
This is one of the last family portraits of Bob and Karen LaRoche and their two children, Emma and Michael. On November 6, 2013, Bob lost his year-long battle with esophageal cancer. He was just 44 years old, but his symptoms actually began years earlier.
He was treated for acid reflux, and he would complain from time to time that it would bother him, and he would see the doctor and have the medication adjusted if needed.
Bob was vigilant about taking his medication for acid reflux, but was never scoped.
He was a very optimistic person and just always felt the medication was working.
Then in October of 2012,
he started having symptoms where he felt that the food was getting stuck. And he mentioned it to me a couple of times, and I said, maybe you should go see the doctor. And finally, he had a couple of really good episodes that it really bothered him when it got stuck.
Bob finally did have that scope. His diagnosis, late-stage cancer of the esophagus. And despite the latest treatments, Bob lost his battle about a year later.
It was a very horrific disease to die from.
Linda Mulfacey is talking about her father, Salvatore, who died from esophageal cancer 16 years ago. It was because of his death that Linda, along with her daughter, Christina Fry, started the Salgi Esophageal Cancer Research Foundation, and now Karen and her mother are involved.
We have to raise awareness first and foremost, and we really do want to raise funds for different research groups to try to find a solution for this.
It's preventable. People need to be vigilant. People need to, if they know that they have symptoms of GERD and acid reflux, they need to be scoped. That's really important to have that checked out.
Being scoped involves putting a thin lighted tube down the throat so the esophagus can be examined. The bottom line is this: acid reflux should never be ignored. By the time you have symptoms of cancer, such as difficulty or pain swallowing, your cancer is probably advanced and survival rates are low. To help raise awareness and money to help fund much needed research, the Salgi Esophageal Cancer Research Foundation will be having a walk. It's this coming Saturday, June 14th at Warwick City Park. It's beginning at 9 o'clock. For more on this walk and more on esophageal cancer, log on to turn10.com and click on health. And that's Health Check. Barbara Morse Silva, NBC 10 News.